It's a pleasure and a privilege to come along and be a small part of this great day and see old friends. So I was given this title, so I have worked to it the best I can, but this role of genetic counsellors in the Niemann-Pick diagnostic pathway. Now, it's kind of tricky because most of you will have already gone down this path, and so it's looking back perhaps on how things could have been done differently or how well they went for certain reasons. And I guess it's just important to see what the role is. So if you're communicating to other people, there's an understanding of how genetic counsellors might be able to help. It's not a really familiar profession yet. I love this quote. It's more important to know what sort of patient has a disease rather than what sort of disease a patient has. Now, obviously, that's not entirely true. It's really important to know what someone has going on. But ultimately, if you have a diagnosis, how that person should be managed is vastly different from one to the next, and what they need and how best to support them will vary enormously. So it's incredibly important, and Dr. Osler figured that out a long time ago. So why is genetics often so complicated? So if you go and see a GP, you have an idea in your mind of why you need to go and what questions you want to ask, and you're only thinking about yourself. But in genetics, we have to encourage people or support people to think about their family as well, because that's the nature of genetics, is we share it with our families. The impacts of decisions that people make about genetics and genetic testing can be far-reaching. So you might have people who are doing predictive testing, where they're finding out what the future might hold, whether they're going to develop a condition or not. You might be talking to people who are making decisions about whether to continue pregnancies or not. And so these decisions and finding out information that might impact on family members as well. So they can be far-reaching, could be family members you don't ever talk to, and you don't want to open that box of having to go to people that you might have difficult relationships with and want to talk to them about these complex sorts of issues and very private issues as well. The general public have, and many doctors, I'm blown away the number of times I've done talks to non-genetic specialists who really have the most basic concepts. And what I've learned over the years is never to make assumptions about people's level of understanding on genetics. You know, often it's what they learned at uni, which is very minimal. And genomic literacy is often based on what's projected in the media, which is, you know, basically dramatizing something and often not entirely accurate. So that makes it a really tricky starting point when people don't have a good understanding of basic genetics. And it's constantly changing. So our understanding of genetics is rapidly evolving. We have about 20,000 pairs of genes, but we only know the function of about half of those. So every day there is a new gene that's being characterized. So another laboratory is finding out what this particular gene does. They write a paper, they publish that, and then around the world that filters out, and people find new diagnoses for patients that previously didn't have a genetic diagnosis. So it's constantly changing. We have to keep up with it. Who are genetic counsellors? This is the boring stuff we'll skip through, but essentially, mostly these days, almost always these days, they come from a science background. But back when I did the course back in 1997, a long time ago, there were people that came from nursing backgrounds, from social work, from teaching. Now the science is such that it is quite tricky to come into this field without a solid science background. So mostly people are coming from undergraduate science degrees and moving on from there. It's a master's. There's only 2 programs in Australia, despite the demand for this profession, one through Melbourne Uni and one at the University of Technology in Sydney. The good thing about the UTS program is it's a distance program. So there's people from all around, you know, West Australia, Queensland, Tasmania, New Zealand that can participate in that course without needing to move for it, which in Melbourne you have to be located here. It covers a combination of genetics, counselling and research skills. When I see someone, and the title genetic counsellor is a little bit misleading. So many people will say to me, I don't need counselling. You know, that's a very standard line, especially, and I hate to generalise, but, you know, men people from the country, I don't need a counsellor. I don't need to talk to anyone. I'm fine. And so I sometimes try and deflect that, and I'll say, I'm not a psychologist or a psychiatrist. The counselling really is around the fact that you can't talk about this kind of information without taking into consideration the impact it might have from an emotional and psychosocial perspective for that person, their relationships and their family. So it's basic counselling skills, but actually another thing I've learned over the years is basic counselling skills are the same no matter what profession you're in that it's all about active listening. It's about being empathic with people. It's about reflecting what you're hearing and reframing what you're hearing. And they're the basic tenets of any counselling. So what actually is genetic counselling? So it's about helping people to understand complex information and adapt to that, and also appreciate the familial implications of that as well. So it's about interpreting complicated information that, you know, I was just standing with Mandy before, and you listen to her talk about NPC and it's like a doctor is talking, right? And people get upskilled in something they previously knew nothing about. When you have a vested interest in understanding something and being an advocate, you learn it very quickly. So, but at the start, when you're first hearing, I'm sure, Mandy, you remember hearing this information at the start, it sounded like someone was speaking another language. And so it's about trying to interpret information in a way that's meaningful, because everyone comes from a different start point. So, I mean, even if you see someone who is a professor of genetics, which I have seen over the years, people from those types of backgrounds, when it comes to what this means for their child or their sibling or their partner, everything goes out the window. So it's tailoring that information to be pitched in a way that's meaningful for that person in front of you and no one else. There's no one size fits all. So it's educating people about inheritance, testing, management, all those sorts of things, providing resources. And the counselling part is about helping people to make informed decisions and feel empowered to do that, and adapting to the risk or the condition itself, which again can take varying periods of time for everyone. Everyone's different. There's about 500 genetic counsellors, which maybe sounds a lot, but isn't really, given that a significant proportion of those work in education or laboratory, private. There's a large number of private genetic services that are starting up now. So there's a lot more genetic counsellors working in private IVF services and ultrasound practices and population screening. So in hospitals themselves, there's really not that many. It does vary between hospitals, and some are integrated into specific departments, like neurology might have a genetic counsellor, but much more often there is a genetics department, and other departments in the hospital will call on a genetic counsellor to come and support them in their particular clinics. The problem, and we've had a genetics department at the Children's Hospital for, 40 years perhaps, and even now, doctors still are not aware of the role of genetic counsellors. They don't think to bring them in at a time of a diagnosis of a genetic condition. And so that's frustrating, because often we're brought in after the fact. And if we'd been there up front and right at the start time, it makes everything easier. So that's what we're trying to advocate for in hospitals. And what can we offer? We can attend where the diagnosis is being given. And the most helpful thing then is listening to the same information that the family's listening to, and then being able to follow up and translate that information into a more palatable way. I'm sure all of you have been in situations where you've seen doctors who basically speak in another language and they use words that you're not familiar with, because once you know something really well, you forget what it was like to not know it, and you just keep talking in that way. And doctors tend to hang out with other highly educated professionals, so they drop those words all the time and don't even think twice. So the role of a genetic counsellor is really to be hyper aware of those complexities of the words that we're using routinely in a hospital setting or a medical setting, and simplify those to whatever level the patient or family might need. Help to clarify anything that wasn't understood or remembered, provide information to the extended family, so often that's something that comes up pretty quickly, and provide follow-up support that oftentimes the doctors don't have time to do, or they don't think to do. They sort of give the diagnosis and then off they go and get on with their busy day. So a genetic counsellor can follow up and really provide some ongoing support there too. I will come back to that stuff, but I guess I just wanted to think a little bit about what the benefits are of making a genetic diagnosis. So we kind of just assume that getting a diagnosis is the most important thing. A clinical diagnosis and a genetic diagnosis are two different things, right? Because essentially a clinical diagnosis is the most important thing. It's what symptoms someone has. A genetic diagnosis is confirming on a molecular level, so a cellular level, what's causing those symptoms, the physiology or the pathophysiology of that. So the sorts of benefits that come from it is providing clarity even where a clinical diagnosis is strongly suspected. A lot of you will have had the experience of the diagnostic odyssey. I look at Mandy at that point in time too, where there was a traversing of a period of time where no one knew what was wrong. And you were seeing different doctors and talking to people, and everyone had a different idea, but no one really knew what was going on. And I guess having a clear diagnosis is a totally double-edged sword, but it does take away that diagnostic odyssey, that constantly searching for answers for why things are happening, doing endless tests and unnecessary investigations. It obviously, and most importantly, can inform clinical management, provide access to appropriate medications, clinical trials where they might be available as well. Provides surveillance options, so the opportunity to ask, are there other people in the family who could be at risk? Let's skip through. Provide reproductive options, both for the immediate family and the broader family as well. So they might consider doing pre-implantation genetic diagnosis, which is an IVF technology, or prenatal diagnosis, which is testing of an existing pregnancy. And providing psychological benefit. Some of you might say psychological harm at some point along the way, but benefit by ending the diagnostic odyssey, as I said, and allowing a bit more that, here I am talking about simplifying words, prognostication. So what the future might hold for that person. Now, no one ever knows what the future is going to hold for anybody, regardless of whether they have a specific condition or not. So very often the first question people have is, what's going to happen? When will they lose skills, or when will things become dramatic? No one can answer that question. And it sounds, when you listen to a doctor talking about that and they say, I can't tell you that, it sounds like they're avoiding giving bad news or information that might be hurtful or harmful to the family. It's actually true to say we don't know what the future holds. If you think of someone who doesn't have a medical condition or a genetic diagnosis, we don't know what the future holds for them either. And so it's no different, even though you have a condition. It's only a tiny part of what makes someone who they are, and it's going to be different for everybody. So when I see someone in clinic, the sorts of questions we get asked after a diagnosis has been made, who should I tell? So there might be that sort of knee-jerk reaction to, let's just tell everybody what's going on. And then you have to stop and say, okay, where is this going to benefit? Am I going to find that I constantly have people calling me and asking me how I'm doing when I don't want them to? Am I going to have people treating me or my children or my partner differently once they get this information? So actually that needs some slowing down. Let's talk through who's going to be helpful for you to tell and who may not be quite so helpful. Or, in the stepwise way that might happen, and role playing a little bit of how you might tell people. How and why did it happen? That natural tendency for us to blame ourselves. Mothers in particular have a very natural tendency to think that anything that's happening in their child was caused by them in some way. And so clarifying genetic information, we all carry genes that don't work properly, the contribution from both parents, even in a condition that's only passed on by one parent, is actually quite equal in lots of ways. So clarifying, normalizing, we all carry genes that don't work. We have no control over what we get and what we pass on. That kind of thing is really important to clarify up front. I feel guilty. How do I cope? Genetics is all about guilt. I don't think I've ever seen any family where there wasn't a sense of responsibility that I caused this to happen, which actually, if you project that question to someone else who comes to you and says, I feel guilty, we're all really good at being kind to other people, right? The first thing you would say to someone else is, don't be ridiculous. This is not your fault. You had no control over this. But when it comes to yourself, the first thing you do is blame yourself. why did this happen? What did I do to cause this to happen? So I often try and turn this around for people and say, can you imagine you're talking to someone else who had a family member diagnosed with this condition? And what will you say to them? I bet you'd be really kind. And so trying to turn that kindness onto yourself is a challenge constantly, quietening that voice in your head that says awful things to you. Often there is some dramatic thing in the family where there's a family member who's pregnant, or there's someone who's planning pregnancy, and what does this mean for them? And it all becomes a crisis, and how to support other people is important. So genetic counsellors can obviously help to navigate that. And people want to know, what are the chances of this happening again? So it's talking through those types of things, plus a complete range of whole other things that are unique to each individual family, that matters to them. I just put this up because I think it's useful to go over it again when people are thinking about what the risk is once a diagnosis of a recessive condition like Niemann-Pick comes about. So you're looking at a condition where we know Niemann-Pick's in the family. You've got two parents who are known to be healthy carriers of that condition. And then they say, well, what's the chance for someone else? And it often is this sort of very concerned, the risk must be high because this is in front of me now and that's all I can think about. The risk is actually not very high. There's a lot of genetic conditions, cystic fibrosis and spinal muscular atrophy, that are much more common in our population than things like Niemann-Pick. So it's often reasonable to reassure family members that the risk is low. Testing is available. These days, when people are planning pregnancies, often GPs or obstetricians are talking about reproductive carrier screening, and that's where a whole up to 500 or over 1,000 genes can be tested to see if someone's at risk of having a child with that condition. Niemann-Pick is included in those big panels, so people can routinely have testing for that to see if they're at increased risk. And genetic services, so GPs and obstetricians can help to a point. If there is a family history, it's always worth talking to a genetic service about making sure accurate testing has happened for NPC. I don't have too much more. I just wanted to say, when you look at how people cope, we see that people get, and often in couples, you get one of each, right? You get an information seeker, so the person who needs information to feel more secure, and it's probably a lot to do with controlling what you can control. You've lost control of the situation. You've got this awful diagnosis you're facing, and people sort of say, I need to know everything I need to devour all the information I can. And then you get others that say, actually, I don't want to know any bad stuff. I just want to know what I need to know to get through today and tomorrow and next week. And that can be really difficult to navigate when you've got one parent asking constant questions and the other one going, la, 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 I don't want to hear anything that you're talking about now. So trying to manage the ways couples and families cope differently can be really challenging. And it often causes a lot of friction between people and family members. And so that's a big part of the role as well. And just to go, this is nearly the end. You know, I'm preaching to people who know this much better than me, but, you know, when a family member or a child is diagnosed with a genetic condition, the family faces a whole slew of emotions, all sorts of things. You know, I'm sure there's words much more in addition to what I've put on here that come up, and everyone copes differently, as I said, and it can really put pressure, you know, when friends don't know what to say and so they avoid you. It's that whole, it is a form of grieving, a new diagnosis, and people want to be there, but then they say the wrong thing, or they're worried they'll say the wrong thing, so they say nothing, and so they withdraw. And I'm sure everyone in this room has experience in some way with that kind of thing. Parents of children with chronic illnesses often say that they have it at the front of their minds most of the time, and it impacts every aspect of their lives. So it's really trying to find ways to live the best life we all can in the face of something unexpected and devastating, like a diagnosis of a chronic condition. Living with chronic illness can be like living with a ticking time bomb and just waiting for what the next day is going to bring. Trying to bring yourself back to live in the moment is one of the hardest things to do when you feel like you need to plan and prepare for what the future might hold. You know, anticipatory grief is a real thing, and it can be hard to pull yourself back from that and try and get pleasure out of each day. I've already said that one. And Dr. Google, oh my God, you've all got experience with Dr. Google. You know, it's really challenging to try and navigate what is accurate, useful, helpful, and not. No one's monitoring the internet. You can put whatever you want up there. So it's really hard to know what's real and what's not. And using health professionals like genetic counsellors can be helpful in that too. So in summary, genetic information is family information, which makes it more complicated. A genetic diagnosis brings unique features of grief, guilt, and uncertainty about the future as well. Navigating the healthcare system is incredibly challenging. Again, I bet everyone has experience with that. And trying to meet the needs of every personality that's involved in the care of an individual can be particularly hard. And there's no one-size-fits-all approach, which makes it really hard to set up some sort of protocol of how to manage people and their families. And genetic counsellors can help. So if you have access to one, you can ask if you can see someone. If you have any issues that are related to the sorts of things I talked about there, you know, definitely speak up. And that's it from me.
My husband and I are both carriers. We have a son who's 50 with NPC and a daughter who's almost 45 with NPC. I have 4 brothers and sisters. There's 5 of us and there's 4 of Harry. And is there anything looking into the carriers of how they're expanding? I think when we were told in 2014, we were 1 in 100,000 chance of getting together. If I look down, because both of our parents have passed, we don't know which side of the family came the carriers to us. If it was my mother, there are 32 kids out there that are possible carriers, 2 of which have been tested, which are my 2.
Yeah.
If it was my father's side, he's one of 9 children. And if you look at all the numbers that are coming in the future, there's going to be just a mass of carriers that are possibly meeting other carriers.
Yeah.
My big bugbear is, yes, you've got to go to a GP, then you've got to be genetically counselled before they can actually do a test to see if you're a carrier. We should have, as an organisation, we should have some link that we can go to say, okay, you can go and have a blood test and find out if you're carriers, and simplify the process so that it's not a long drawn out process to get tested, because it's going to improve things in the long run if we can prove that you're not a carrier or whatever. So that's just my point.
No, you're absolutely right. The challenge at the moment is funding for testing like that is often limited to genetic services. Taking the burden off yourself of providing information to family members is often what I say to people. It's, you know, don't feel like you have to go and tap people on the shoulder and say you should get carrier testing. These days, before people have babies, the responsibility is on the GP or obstetrician to talk to them about carrier screening. And as I said, that's becoming much more common, where they get tested for a whole lot of conditions, which is important not to just focus on this one, but on the other more common ones. You don't want to avoid Niemann-Pick and have a baby with CF. You know, you want to cover a whole lot of conditions, but the funding's tricky. I wish it was as simple as having a link to say this is how to access carrier testing, but unfortunately it's not. We just have to hope that people will get the information they need if they're planning pregnancies, to know if there's a risk.